Hi everyone, this is Larissa.
Hi,
I'm
my name is
Cynthia.
Andrea. Oh, sorry. My name is Andrea.
Okay, we're gonna do our presentation, leadership in nursing. So I'm gonna start by talking about integrity. Integrity, it's one of the cornerstones of nursing. It is very important for our profession to maintain our integrity while working, while caring for patients. And per Gideon's, they define integrity as the quality of being honest and having strong more principles. It is essential for nurses to advocate for patients and maintain ethical practice even in the face of personal discomfort. Moving on to an example of clinical integrity, I'm going to mention an example that happened to me while I was in my clinical rotation a while ago. One of my patients had antihypertensive medication due, and the nurse that I was helping that day that I was following, she asked me to take the vital signs before she would come in the room to give those medications to him, since that medication has a parameter of the blood pressure. So I did that. I went in the room, checked with the patient, took all the vital signs, and then I went back to the nurse to report my findings. And I told her that the BP was lower than the parameters for that medication. Although as a student, sometimes it's very uncomfortable to be in that place where you have to speak up to your either professor, your nurse that you're helping that day. I had to do that because above all else, we have to care for patient safety. And that's just like one example where we are maintaining our integrity while caring for patients. Um, Continually with this decision making, it's also a cornerstone of nursing, of our profession. We have to be um, able to make good decisions that are within safe parameters. So safety always comes first when caring for patients. As well, you have to recognize patients' priorities and other influences that might be important for a patient, like their culture or anything like that. So in order to make a good decision and evidence-based care for your patient, you have to make good decision. You have to be critically thinking. So for games again, we have that decision making is a continual process in professional nursing practice. You have to be able to, like I said again, use evidence-based practice while caring for your patient and make sure that you're being safe above all else.
Okay, I'm going to be talking about change, and change is basically the transition of an old state to a new state. And change often happens through updated policies, protocols, evidence-based practices, and in reference to leadership, leaders usually guide change to help the organization reach its goals and visions. Leaders also influence change through effective communication. I'm still on the first one. Okay. Okay. Leaders also influence change through effective communication, understanding the unit's culture, and being flexible by always considering ways to meet goals. They also manage differences between the staff because not everyone adapts to things at the same pace, basically. So the leader is basically the one who motivates the team and supports the vision, which improves teamwork, consistency, and patient safety. So one of my examples was during clinicals, there was a new policy whereby the nurse leader wanted the nurse to start doing hourly checks on the patient because apparently they were getting out of bed by themselves when a lot of them were fall risks. But with that being said, the patients still were not complying with that, and they basically told the nurses to um they basically wanted the nurses to go in there each hour. And for some reason, a lot of the nurses felt like it was extra work added to what they were supposed to do. But the leader had, encouraged everybody and, talked about the importance of patient safety, basically. So that was part of the changes. And then the next one for me was critical thinking. So, critical thinking is basically a cognitive process that is used for analysis of an issue or a problem, and that was according to Giddens. Okay, so critical thinking is not exclusive to one profession or discipline, and it is also not dependent on a particular situation. That basically means it's a skill that can be applied in many settings because um you can apply it anywhere basically, but it's mostly needed in nursing. And the third one was critical. No, I'm not done.
Oh, you're back there.
Yeah. Okay, so critical thinking is also necessary in order to engage in clinical reasoning, and nurses use critical thinking to interpret assessment findings, recognizes the changes on a patient's condition, and they also use that to make safe decisions. And this helps the nurse provide safe and effective care and support for the patient outcomes. I'm done with that one. Okay, so my critical thinking example was basically a S-bar. So this patient suddenly became short of breath and their O2 begins to drop on room air. And the patient was post-op, had been in bed all day, and was stable earlier. After assessments were performed, we found increased heart rate, respiratory rate, lung sounds were diminished, and there was crackles, patient was anxious, and the oxygen continued to drop. So my first instinct as a nurse or nursing student was to call the respiratory therapist, increase the oxygen, and also to get orders for chest x-rays, and also to get ABGs. Okay, that's it for that part.
I am going to be talking about communication. So communication is a fundamental human process that is essential to social interaction and professional nursing practice. Giddens describes communication as a process of interaction that uses shared symbols to create, exchange, and interpret meaning. Effective communication is especially important in nursing because it directly supports patient safety, collaboration, and quality care. Um, and one of the best ways, or one of the greatest tools that especially a nurse has for peer-to-peer communication is the use of an S-bar, because it just promotes clarity to be able to reduce errors when you're communicating, your patient's needs. Next slide. Okay, so one of the examples that I myself witnessed of great communication using a verbal S-bar was when an RN, she in the NICU, she just noticed that the infant she was taking care of was kept regurgitating the continuous feed that she was on. So she called the physician, explained that the situation was that the infant was experiencing frequent regurgitation on the continuous feed. She explained the background, which in this scenario was a 100-day-old infant that had continuous breast milk feeds via an OG tube. Her assessment was that she recognized the intolerance of the feeds because of the frequent regurgitation, and she suspected it could have been because of just excess air in the stomach. So her recommendation to the provider was to add a ferro bag to allow for gastric venting in the hopes that that would reduce the regurgitation of the feeds. The outcome did end up being that both the RN and the physician agreed on the plan. And once she added the ferro bag, the infant did stop the regurgitation and the feedings improved. So this example very clearly shows how the communication tools, such as an S-bar, promoted the clarity, it reduced errors, and it supported safe patient outcomes. And also shows leadership on part of the nurse that she recognized this and decided to do something about it. Okay, and then the last thing we'll be talking about is professionalism. So nursing professionalism is a multidimensional and dynamic concept that is demonstrated through a nurse's knowledge, attitudes, and behaviors in clinical practice. According to Kyle and the colleagues, professionalism develops over time and directly influences the quality of patient care. Professional also includes professional identity formation, which begins during the nursing education and continues to evolve through clinical experience and reflection. Giddens further describes the personal identity as thinking, acting, and feeling like a nurse, which is guided by values and also just norms of the nursing profession. And one example that you will basically see on any shift you are ever on is just the nurse leaders of the shift, especially the assistant nurse managers or the charge nurse. They demonstrate professionalism through accountability, advocacy, caring, and evidence-based practice, which helps promote patient safety and quality care. And this also uses, and by being also just a resource to all of their staff nurses. And it just shows respectful communication and supports the staff to ensure safe and effective patient care. And that's our whole presentation.
Yeah, these are the reference we used for our presentation. So we use cow and the other the other
The books.
yes, the other people that helped for that journal. Was it a journal? Article,
An
sorry.
article.
Correction. We used Giddens as well and Yoder for and we listed everything, the page numbers in each paragraph. So yeah, that's our whole presentation. Thank you.
Thank you.
Thank you.